Here is a comprehensive overview of naloxone, addressing all your requested points. 1. Generic name, drug class, brand name. Generic name, naloxone, drug class, opioid antagonist. Brand names, Narcan, Cloxato, Evzio, discontinued but previously used. 2. Definition. Naloxone is a medication used to rapidly reverse opioid overdose. It works by binding to opioid receptors in the brain, blocking or reversing the effects of opioids such as respiratory depression, sedation, and hypotension. 3. Mechanism of action. Naloxone is a competitive opioid receptor antagonist. It displaces opioids from the mu, key kappa, and D delta receptors in the central nervous system, especially the mu receptor, effectively reversing opioid effects such as respiratory depression and sedation. 4. Indications. Naloxone is indicated for emergency treatment of known or suspected opioid overdose, reversal of opioid-induced respiratory depression, diagnosis of suspected acute opioid overdose as part of opioid safety kits for individuals at risk of overdose. 9 of 5. Contraindications. Known hypersensitivity or allergy to naloxone or any of its components. 6. Before taking this medicine, precautions. Inform your healthcare provider if you have a history of heart disease, you are pregnant or breastfeeding, you are taking medications with opioid effects. Be aware that naloxone can cause withdrawal symptoms in opioid-dependent individuals. Use with caution in newborns of opioid-dependent mothers. 7. How to use. Intranasal Narcan. Spray 1 dose into 1 nostril while the person is lying on their back. Intramuscular subcutaneous, IMSC, inject into the thigh or upper arm. Auto-injectors, Evzio, provide voice instructions. Intravenous, IV, administered in hospital or advanced care settings by trained personnel. If no response is seen within 2-3 minutes, repeat the dose. 8. Dosing information. Adults and children 1 year, intranasal, 4 milligrams as a single spray in 1 nostril, may repeat every 2 to 3 minutes. Adults and children injection, 4.4 milligrams to 2 milligrams IMSC every 2 to 3 minutes as needed, up to 10 milligrams total. Pediatrics 20 kilograms, 0.1 milligram kilogram IMSC every 2 to 3 minutes, may increase to 0.1 milligram kilogram if no response. Tar 9 missed dose overdose. Missed dose not typically applicable as naloxone is used in emergencies. Overdose symptoms: elevated blood pressure, tachycardia, tremors, seizures. Treatment: supportive care. Naloxone has a wide safety margin. Stop or avoid taking. Do not use naloxone as a substitute for emergency medical care. Avoid unnecessary repeat use unless signs of overdose reappear. Discontinue once the person is stable and no longer showing symptoms of opioid overdose, under medical supervision. 11. Side effects in detail. Common side effects: nausea and vomiting, sweating, tremors or shaking, increased heart rate, tachycardia, elevated blood pressure. Serious side effects: acute opioid withdrawal symptoms, restlessness, body aches, diarrhea, irritability or aggressiveness, runny nose, fever and chills, goosebumps, seizures, pulmonary edema. 12. Vital information. Naloxone only works on opioids. It won't reverse effects from benzodiazepines, alcohol, or stimulants. Always seek emergency medical help after using naloxone. Naloxone may wear off before the opioid, requiring repeated doses. Naloxone is safe for bystander use and available over the counter in many areas. 13. Other drugs will affect. Naloxone's efficacy may be influenced by partial opioid agonists, e.g. buprenorphine, may be harder to reverse. Mixed agonist antagonists, e.g. pentazocine, may require higher doses. Naloxone may precipitate withdrawal if the patient is on methadone, oxycodone, heroin, fentanyl. No known major interactions with non-opioid medications. Thank you. Have a nice day.